All right, everybody. So we got module 7, common challenges in phlebotomy. All right. So let me just start off with, what are challenges? What do I mean by that? You're going to encounter some situations where you may not be able to perform the procedure, or it's going to affect how you collect your specimens. This is where we're just going to kind of go through some of those that you may encounter and what you could expect with these different conditions and challenges. So first we have arthritis. So they'll bruise easier a lot of times, or they may bleed longer than a healthy patient. If they're on some steroids, they may have some shrunken veins. Edema is where there's swelling in the tissues, and it can hold a lot of extra fluids in the space of their cells. This could actually cause some diluted samples. Unconscious patients, the doctor does assume consent for these patients. You want to make sure that you have an abundance of caution when you're working on any emergency draws. IV therapy, make sure that there's a discard tube of 5 to 7 mLs before drawing your actual specimens. What this means is draw a discard tube before your actual specimens are done. That discard tube does get thrown into the sharps container and disposed of. It is not used for any tests. Okay. IV therapy can change the results. It takes a full 2 minutes for the blood to travel through the body. So the nurse needs to stop IVs 2 to 5 minutes beforehand and never put a tourniquet over the IV site. Mastectomy patients. So these are patients that have had breast cancer either on one side or both sides. You must have a doctor's written permission to draw from the side of a mastectomy. So if they had a mastectomy or a breast removal on the left side, you want to draw from their right side. If they've had a double mastectomy where both breasts are removed, you want to have the doctor's written consent to say that you can draw from the either left or right side during that double mastectomy. Syncope is where a patient has or does pass out during a blood draw. If it is a known patient that passes out or has a syncopal episode, make sure the patient lies down before you even do it. You never want to leave an unconscious patient unattended. If they do pass out, you want to alert the nurse via the alert button if you're in a hospital setting or nursing home or inpatient. Otherwise, you would want to try to get a provider available as soon as possible. Seizures. So some patients may start to have a seizure during the procedure for various different reasons. They may just have a seizure condition. You would want to take the needle out immediately, hold their head stationary, or put it on something soft and roll them on their side. For brachytherapy, so brachytherapy is treatment where the patient is injected with radioactive material. No one that is pregnant should ever enter a room with a patient that is undergoing brachytherapy. They may not be actively getting their injection, but if they are in active treatment with brachytherapy, they are still emitting radiation and can affect those around them. You will be given a little radiation badge or specific PPE to enter the room if you are not pregnant to draw their blood. Allergies. You want to make sure you know if a patient has a latex, Band-Aid, iodine allergy. Sometimes if they're allergic to shellfish, iodine may cause anaphylactic shock. So be aware of what you're using and if your patients have allergies. Hemorrhaging. So if a patient is on any type of blood thinning or blood thinning conditions, aspirin or Coumadin, Jantoven, warfarin, however you want to say it. There's Eliquis, other types of blood thinners. Hemorrhaging can happen. This is internal bleeding where the site does not clot within 5 minutes. Petechiae, these are little small red flat spots on the skin. They're not usually raised in appearance like rashes normally are. This is petechiae. Just notated on the requisition, it's not going to affect your actual blood draw. Isolation. We had talked about isolation a few modules back. So making sure that you follow proper isolation protocols and wear the proper PPE and not take anything into the isolation room that you're not actually going to need for that blood draw. So don't take extra stuff in there. Oncology is another type of challenge. So a lot of patients that are going through chemo or different types of cancer treatments may have poor veins and are likely to. They experience excessive bleeding sometimes and are also immunosuppressed. So you want to be super careful with these patients. An infection a lot of times is detrimental to them because their body can't fight it. Dialysis patients. So as a phlebotomist, you may actually end up working in a dialysis center. So never draw from grafts or shunts and never place the tourniquet over the grafts or shunts. Spastic cerebral palsy. Due to defects in the central nervous system, they can't control their reflexes or body movements, but their mind is okay. So they may move or jerk or twitch, but they are able to consent like a normal person. Quantity not sufficient. Sometimes you may not get enough of the specimen to do the testing that you need because they don't present with viable veins or there's an issue with technique. Try a tourniquet protocol, hold a fist without pumping their hand, hold their arm down to see if gravity helps, rotate the patient's arm and try to bring the veins to the surface. Try using heat, apply another tourniquet below the intended site. Only leave it on long enough to find the vein and then take it off. Or you can use a blood pressure cuff. Sometimes a patient may be in a coma. Consent is required from the physician who ordered the lab. So unconscious patients, the physician gives the consent. Mentally ill or combative patients, they still have the right to consent to the blood draw or not. Okay. So just because they are mentally ill or combative doesn't mean that they can't or that you don't listen to them if they say they don't want their blood drawn. They still have the right to consent. But I do recommend taking somebody with you if they are combative or have mental illness, because that's somebody that can help you or be a witness if something does happen while you're in the room. Geriatrics. These are old people. So as the body ages, our senses become more attuned to heat, cold, and pain. So they will be more sensitive to these things. Pediatrics is another challenge. The patients are smaller. They're kids. They don't always follow directions. They're more likely to move. So neonates are babies or children from birth to 6 weeks old. Infants are 6 to 1. Toddlers are 1 to 2. Preschool is 3 to 6. Pre-adolescent is 6 to 12. And a teenager is 13 to 18 years of age. Bilirubin or blood urea, nitrogen, creatinine, blood glucose enzymes, and a CBC are very, very frequently drawn. You only need 0.5 to 1 ml of blood for these tests. Newborns are limited in the amount of blood that you can take from them, okay? They only have 80 to 110 mLs of blood in their body, so you cannot take more than 2.5 at any given time. This is where those heel sticks with the microvet containers come in handy. Microsamples or microtubes or the bullets. These hold 0.2 cc's or mLs of volume of blood, and they must be filled completely with no bubbles. So venipunctures, which I will teach you how to use these in the office. Venipunctures are okay for 2 years and over. Venipunctures after the age of 2 can be done with a butterfly of 23 to 25 gauge, or a syringe should be used. There should be no finger sticks done on somebody under 6 months old. Okay. You can describe the topic of this section here, and heel stick should be used instead. What? Oh, heel stick should be used instead on people, on babies under 6 months. Most common tests are the microtubules for pediatrics. sodium, potassium, phosphorus, bilirubin, all of these things, and one lavender microtube, which I will show you in the office. Okay, so some other vein selection challenges. Small veins. Okay, small veins can be unstable, especially with a tourniquet. They must control back pressure on them and use small tubes or a butterfly. Deep veins, usually bigger the patient, the deeper the vein. Rotate the antecubital fossa to pop the veins out or make them more visible, or you can feel them better. Sclerosed veins are not suitable when a vein feels hard or bumpy. This means it could be thrombosed or valvular. Don't use it. This includes hard cord-like veins. Normally, they present in chronically ill patients or from drug use. Do not use these. Extremely muscular patients actually will have a lot of rolling veins. There's a lot of muscle that ends up with making it harder to anchor the vein. So you want to alter your venipuncture technique for these patients. Rolling veins should be avoided when possible, but if you have to use one, make sure you anchor it properly. Rolling veins are present in geriatric patients who have lost muscle mass or in patients who are extremely muscular. All right, guys. Module 7 key terms. Go back, do your flashcards, study these terms. Let me know if you have any questions or if you have any suggestions for making this section better. Have a good day.